So, just a few observations about the content of this webinar looking at supersized alcopops. So, it's a topic that fits squarely into two of the focal areas of our PTTC policy and health disparities. And it also builds on the programming that we've done lately on alcohol policy. So many of you were able to participate in our three-part series, the why, what, and how of alcohol policy. So I think this is really aligned and in some ways builds on that. So like I said, we're also excited about our presenter, Dr. Matt Rosheim. I've known Matt for 2 or 3 years now. I wish I'd known him longer. He's doing amazing work in the field. I think when I met Matt, he was at George Mason, but is now an associate professor in the School of Public Health at the University of North Texas Health Science Center. Boy, that's a mouthful. I guess you have to learn to say that and not burn up too much time. That's in Fort Worth, Texas, I believe. So he has 10 years of experience, over 10 years of experience doing research related to alcohol policy, alcohol control. And a lot of that is focused on the retail environment and particular products like supersized alcopops. So he's published widely, 64 peer-reviewed publications. But his work is really getting a lot of attention nationally. So it's been featured in the New York Times, NBC, CNN, BBC, Washington Post, Newsweek, NPR. And the one that really impressed me is Last Week Tonight with John Oliver. So that's very cool. The work is also having an impact on policy. And so it's been cited in both reports and in local policies and regulations put out by the Food and Drug Administration, the World Health Organization, and city and county ordinances, and even the Canadian government. So without further ado, let me hand things off to our presenter, Dr. Matthew Rosheim.
Thank you so much for that warm introduction. I'm very excited to be sharing my research with you all today on supersized alcopops and hopefully having some discussion with you all about what localities can do to make changes regarding the availability of these products, which really make dangerous quantities of sugar-sweetened alcohol available to young people. So what we're going to be covering today is I'll talk a bit about the public health implications of alcohol marketing, including price and availability on alcohol use, especially as they pertain to, as Mark mentioned, existing disparities, exacerbating disparities, and consumption among young people. We'll talk about some national disparities in alcohol marketing, access, and consumption. I'll explain what supersized alcopops are, why they are especially problematic, and how they highlight aspects of the marketing mix that are dangerous, even for these new alcohol products that are coming out, the hard sodas, hard seltzers, and products like those. And then we'll talk about some strategies for collecting local assessment data and how collecting such data can really build support for local policy change. So you all are probably very aware that underage drinking is pervasive in the US. It results in hundreds of thousands of emergency departments each year and thousands of deaths. What you might not be aware of is that underage young people have a specific preference for the type of products that they consume. So more than 1/2 of underage drinkers have consumed an alcopop within the past month. And this is very much disproportionate to these underage drinkers, this consumption. So what are alcopops? You might be familiar with more traditional alcopops like Mike's Hard Lemonade, Smirnoff Ice, Bacardi Breezers. These were introduced in the 1980s, and you might have heard of them be called things like wine coolers. They've been long criticized for being transitional products, for being products that help facilitate novice drinkers, people who are just used to drinking sodas or things like that, and helping them transition to drinking alcohol. So supersized alcopops are similar in their kind of flavor profile. It's more like energy drink actually in their marketing and profile. But the main difference is the amount of alcohol contained within just one single serving product. And so they can contain usually about 5 up to 5.5 standard alcoholic beverages within one single serving can. So it's binge drinking in a can essentially. So some of you may have heard of products like Four Loko, especially in 2010. There was a lot of buzz about the caffeine being withdrawn from these products, removed from the products. So the caffeine, guarine, and taurine, which are processed like caffeine, are removed now. They're still available on the market. So the only problem left with these products is literally everything else about them, which we'll talk about. So for one is the high level of alcohol content in these. So just two of these supersized alcopops can have the equivalent alcohol content of 11 of the traditional alcopops. And this is important not only because they have higher alcohol content in themselves, but because it's less liquid volume. So it's 1/3 of the amount of liquid that young people or anyone would have to consume to get the same amount of alcohol. And we know that affects their alcohol intoxication level. It's not just how much alcohol you consume, but how quickly you consume it. And especially novice drinkers don't realize how much alcohol they're consuming because, again, it tastes like energy drink. So there's not a lot of great brand level alcohol consumption data in the US, especially for underage drinkers. So the last nationwide study that was conducted was the A brand study in 2011 to 2012. That study found that an estimated 9% of underage drinkers consumed a supersized alcopop within the past 30 days, and 6% overall consumed Four Loko, making it the most popular brand of supersized alcopop among underage drinkers. Moreover, um, it seems that they have a preference for these types of products in that they are more likely to consume supersized alcopops when they are able to select the type of alcohol that they are consuming. Why would underage young people have this preference for these products? Uh, for one, the high alcohol content in a single serving can, so it facilitates being able to uh, party in your backpack. You can put 2 or 3 cans of them and carry around basically a party with you. The high alcohol content facilitates heavy drinking. The youth-oriented marketing, not only on the cans themselves, but as you can see here from the manufacturer's website, the type of advertising that they use and their social media presence is very oriented towards young people. The fruit flavoring, very sugar sweetened flavors that mask the heavy or the high alcohol content. And two of them that we're really going to talk about now are their retail availability and their low price. And I'm going to talk about some research that I've done to examine how these are especially problematic for supersized alcopops. But first, I want to talk big picture about why high retail availability or high alcohol density and low price are really important from a public health perspective. So in terms of alcohol policy levers, we know that differences in alcohol taxes and outlet 1/2 of the overall effect that state alcohol policies have on adult binge drinking. And there's good reason to believe that there would be an even bigger impact on younger populations who have less means to travel long distances to acquire these and have lower disposable income on average. Just so we're on the same page, when I talk about outlet density, I mean how closely clustered alcohol outlets are together. So with regard to price policies, we know that alcohol prices have significant effects on alcohol-related diseases, injury rates, violence, crime. This has been very heavily studied. I'm citing here a systematic review and meta-analysis on this. Similarly, alcohol outlet density has very strong scientific evidence supporting that greater density is associated with increased alcohol consumption on a population level and numerous alcohol-related harms and social problems, not only medical problems, but again, injury, violence, crime, neighborhood disruptions, public nuisance activities. So these are really important policy levers. In fact, two of the most effective public health strategies for preventing excessive alcohol consumption and related harm. And so when we look at the retail availability of supersized alcopops, this was a study that I did that was published in the American Journal of Public Health, where we went on the manufacturers' websites and we had a random sample of zip codes across the US and mapped out we looked at the types of stores that that sold supersized alcopops. And we found that the vast majority of stores that sell these products across the US are gas station, convenience, neighborhood stores. Although youth are more often get alcohol from social sources, when they do get them from commercial sources, these are the types of stores, these gas station, convenience, neighborhood stores, these are the types of stores that youth most often obtain alcohol from. And then when we geographically mapped these and linked it to other zip code level data, we found that we also looked at alcohol outlets in general and looked at the odds that each outlet sold or carried supersized alcopops. And so we found that supersized alcopops were more likely to be sold in communities that had a greater proportion of African American residents, a greater proportion of Hispanic residents, and then even after we adjusted for population size, number of alcohol outlets, and there was greater availability of supersized alcopops in communities that had more families below the poverty line and in states that had weaker alcohol control policies. And so there is, so this is not just something that we're starting to observe with supersized alcopops. There's a long history of the targeting of low-income minority communities with not only marketing, disproportionately more marketing and availability of alcohol in general, but the targeted marketing of some of their more dangerous or high alcohol by volume products. So malt liquor has greater alcohol content than regular beer, usually about 8% or so rather than 5% ABV, and tend to be sold in greater liquid volume as well, not usually the 12 or 24 ounces, but 32 to 40 ounces in some states. And again, has been most heavily targeted and promoted to young African Americans. So if you just go on Google and do a Google search for malt liquor advertising, it should be very clear who these products are targeted the marketing towards. And as you can see on the bottom right here, it's not just malt liquor now, but these supersized alcopops like Blast today. There's Snoop Dogg advertising Blast on that billboard. So in terms of the marketing, it's not only the availability in terms of whether or not these products are sold, but even things like the amount of designated shelf space for these products. So in higher income communities, they might have one or two of these products, but in lower income minority communities or communities of color, they will have multiple coolers with here you can see supersized alcopops across one, two, this one's just alcopops. Oh, but they have in 24 ounces. So like 4 different coolers with these types of products. And right next to the Four Loco, right next to milk and juice and chocolate milk. So there's problematic, it's problematic in terms of not just the availability, but the product placement as well. We also did research looking at how expensive different types of alcohol products are. And when this one, we focused specifically on Four Loco and found that it tends to be the least expensive ready to drink alcohol product available on the retail market. So what we did is we called a random sample of stores that sell Four Loco in the largest city in every state across the US and Washington, D.C. And we gathered price data. We asked them how much Four Loco costs, what the alcohol by volume is, if they offer discounts for selling more than one at a time, for selling more than one or buying more than one at a time. So what we found is that in the average large city across the U.S., in these gas station and convenience stores, for just $10, on average, you could buy 17 standard alcoholic drinks via Four Loco. Or in comparison, you could buy about 9 standard alcoholic drinks by purchasing 11 Bud Lights. So again, This is twice the amount of total alcohol and less than half of the liquid volume, or maybe about half of the liquid volume that you'd have to consume by drinking these 3 4 Locos that are 23 and a half ounces. So I want us to do just a quick activity right now just to demonstrate how much alcohol is available via Four Loco for just $10 in the average large city in the US. So go ahead and pull out your cell phones or calculators on your computers and open up a calculator, and we'll do an equation here. So if you're a male, then go ahead and enter 63.75. This is the gender constant. Or if you're female, enter 76.5. So for men, 63.75, for women, 76.5. And go ahead and divide that by your body weight in pounds. So I'll do 63.75 divided by my body weight and then hit equals. And then we'll assume that it took you 2 hours to consume these 3 4 Locos. So once you hit equals, after you've divided, subtract 0.034. That's the amount that you would metabolize over the course of 2 hours. So go ahead and hit equals. So go ahead and post in the chat this is what your blood alcohol concentration would be if you consumed just $10 worth of Four Loco in the average city in the US over the course of 2 hours. You drank that. And so 0.55, 0.21, 0.40, 0.29, 0.46, 0.44, 0.665, 0.51. Yeah, so it's important to keep in mind that the per se legal driving limit in the US, where you're legally intoxicated for driving purposes across the US, is 0.08. So a lot of people here are 4, 5 times, even higher than 5 times the per se legal driving limit for adults. And we're adults. We have higher body weight on average and more experience drinking. So for young people, this is especially dangerous. But even for adults, I think the lethal dose, the LD50 for alcohol, is around, I believe, a 0.45 or 0.5. So for some of the participants here, this would be a $10 worth of Four Loco would be a lethal dose of alcohol if you drank it in 2 hours. And again, for young people, it would result in even more dangerously high blood alcohol concentration levels. And this is the average price. So we've identified places where they've been sold for even less expensively. This was one of our collaborators found them on sale in Montana for $1. Notably, the alcohol by volume is 8% rather than 12 or 14% due to the beer cap in Montana. But still, this means that for $10, you could get over 30 standard alcoholic drinks. Granted, you'd have to drink more liquid volume than in the previous example, but for $10, getting 30 standard alcoholic drinks, this is very similar in price to like really inexpensive liquor, more so than the price of any other like ready to drink alcohol product. And it's dangerous because the flavor profile it doesn't taste like strong liquor, it tastes like energy drink. And so what we also notice is that these BAC levels, because of biological differences and differences in median body weight, are especially dangerous for young females. So to examine, who these products are appealing to, and who thinks these products are cool, we set up an eye tracking experiment. When I was at George Mason University, I worked with the psychology department. We brought young people into a laboratory. We brought people who we recruited from summer camps who were, I believe, 13 to 17 years old, and then graduate students who were, I think, 25 years and older, into a laboratory, and we had them do this experiment. We had people take pictures, researchers take pictures in our community of display cases of these alcohol products, and we drew boxes around them once we analyzed the data to see and distinguish which were supersized alcopop versus beer products. So we brought these people into the laboratory, these young people, had them, just like going to an eye doctor, rest their chin on this and look at a computer screen. and we validated where they were looking on at the screen. So we would ask them to do tasks like click on the beverage that they thought looked the coolest to them, and we were monitoring where their eyes were looking, the where they first were staring, how much time they spent staring at different objects. So we were able to objectively record the amount of visual attention that young people were paying to these different products. And what we found in this study was that young females in particular were very drawn to these products. They spent more time looking at these products, and spending more time looking at these products was associated with thinking that they were the coolest products. But even after adjusting for the amount of time that they looked at the products, females were still more likely to select supersized alcopops as the product that seemed the coolest or most appealing to them. So this is dangerous for a number of reasons, including the very high blood alcohol concentrations that they would get from just consuming one or two of these products. So, with all of this in mind, that these products are appealing to young people and that they can result in very dangerously high blood alcohol concentration levels, it's not surprising that when we looked at the Drug Abuse Warning Network data from 2011, there were an estimated 5,500 emergency department visits involving Four Loko. This is likely an underestimation because it's just illegal consumption, so they would either have to be underage drinkers and/or be consuming it with other illegal substances. But there were noted cases, and there was no specific box to check for Four Loko. This was just people writing it in. So again, this is likely an underestimation. Unfortunately, the Drug Abuse Warning Network, there was about a 10-year period since 2011 where they're just starting to launch back up, but there's been no reporting of Four Loko. So unfortunately, this is our most recent available data for this, but still demonstrates that it's highly problematic. There was also research done using the A brand data that found that underage drinkers who consumed a supersized alcopop drank more alcohol and had greater odds of being injured while under the influence of alcohol than those who had not consumed these products. And that's even after adjusting for the amount of alcohol that they had consumed. There was a Saturday Night Live sketch that was put on around 2011 that said that they were pretending to interview one of the makers of Four Loko. So they were satirically, pretending to interview a maker of Four Loko and asking them, to be fair, college students have been hospitalized after using your product, to which the person here with the Ohio State sweatshirt pretending to be a maker of Four Loko responds, yeah, after misusing the product, after misusing it, okay? These college kids are drinking the entire can. Now, what are they thinking? Okay, it's called servings, kids. You got to look at the side of the can. So I think there was a comment directed to me. Let me see if I can see the comments.
Yes, Astrid was commented that most of the studies being cited are 10 years old or so. What, if anything, has changed in that decade? Like amount of alcohol, sugar, other ingredients?
Good question. Yes, I will get to that in this presentation. I promise you. So that is a great question. I will get to that.
Okay.
So shortly after this SNL skit where they call out, the high amount of alcohol content that they're drinking the entire can of the product, the Federal Trade Commission, oops, click back here. The Federal Trade Commission filed a complaint against Fusion Projects, stating that the marketing and packaging of Four Loko is misleading because it suggests that one of these cans is the equivalent of one or two regular beers, where at the time it was actually 4.7 standard alcoholic drinks. So we were curious. What the Federal Trade Commission approved or mandated was these alcohol facts labels be put on Four Loko, and so it basically shows that the servings per container is 4 3/4. So we were curious if this clearly communicated the alcohol content. That was the intent behind this, was to more clearly communicate alcohol content to consumers, but serving size is oftentimes used to communicate the amount of calories that can be reasonably consumed by someone to maintain a healthy body weight. So what we did is we actually went out to in different universities in the US and showed cans of this product containing the label to college students, asking them to estimate how much alcohol is in the product, what they think their estimated blood alcohol concentration would be as a result of consuming the product. And so what we found is that college students significantly underestimated the alcohol content in the products. They thought that it had more like two or maybe three standard alcoholic drinks. So it seems like they're basing it on the volume rather than the alcohol by volume. So as a result, this suggests that limiting the alcohol by volume to closer to that of standard alcoholic drink could improve consumers' estimation of alcohol content. Moreover, what makes this just impossible for people to be able to understand the alcohol content of these are three different alcohol facts panels put on three different products. The first one here with 8% alcohol by volume has 3.1 standard alcoholic drinks. The next one down has 4.7, and the last one has 5.5 standard alcoholic drinks, but they all say 4 3/4 servings. And again, this was the mandated labeling. So, I mean, unless you're like studying these things like me, how could any consumer possibly understand how much alcohol they're consuming? That one is, almost twice the alcohol content of another with the same servings per container. So in their letter, the Federal Trade Commission also noted that consuming just one can of supersized alcopop constitutes binge drinking and is an unsafe practice. And so we were curious, well, how are people actually consuming these products? So in our surveys that we did, we asked about the first time that college students consumed Four Loko. So again, we went out to universities in three different states, Florida, Montana, and Virginia. When we handed these paper and pencil surveys out, we gave them a can of Four Loko so they knew exactly what product we were talking about. So among the just over 1,000 undergraduate lifetime drinkers, we were shocked that almost 1/2 of them had consumed a Four Loko in their lifetime. And although 40% of them were of legal age to drink at the time of the survey, 93% first drank Four Loko when they were before the legal age to drink. So this was really shocking to us. We didn't realize just how much underage consumption of this there was and how prevalent it was. So we wanted to know also, were they drinking the entire can? We found that their first time consuming the product, more than half of them, 58%, consumed at least one entire can, and 10% drank 2 or more cans of Four Loko the first time they were drinking it. Also, among those who finished at least one can their first time drinking it, more than 1/3 blacked out, and nearly 1 in 5 vomited during their first experience drinking Four Loko. Again, indicating very risky consumption. What was also interesting is that we had this kind of interesting experiment where in Montana there was a beer cap of 8%, whereas in Florida and Virginia they would sell up to 12 or 14% alcohol by volume products. And so students in Florida or Virginia were more than twice as likely to black out or vomit after their first time drinking Four Loko compared to those in Montana, even after adjusting for the number of cans of the product that they drank. So this strongly suggests that capping the alcohol by volume could reduce the the likelihood of experiencing negative alcohol-related consequences among underage young consumers. So, with regard to that, in 2015, there were 17 state attorneys general who wrote a letter to the manufacturers of Four Loko Fusion projects, urging them to lower the alcohol content of their products. So what do you think? Did they lower the alcohol content of their products? Nope. What did they do instead? Shortly after getting this, they introduced new flavors. At the time, they'd only had 12% alcohol by volume, but they introduced flavors with up to 14% alcohol by volume. And it seems like a very little difference, the difference between 12% and 14%, it's only 2 percentage points. But when we look at and we estimate the blood alcohol concentration levels, because it's the same liquid volume, this could mean the difference if we look at for 20 to 29-year-old males of median body weight, these were estimates that we calculated using median body weight data from NHANES. So for a 177-pound male, that's the median body weight of 20 to 29-year-olds in the US, if they consumed one supersized alcopop of 12% alcohol by volume, they could still be below the per se legal driving limit. So that 14% might push them over the per se legal driving limit. And again, this is drinking just one can over the course of 2 hours. For example, young females, 13-year-old females, median body weight 115 pounds, drinking 2 cans of the 12% could result in a estimated peak BAC of 0.33, where 14% could be 0.4. So this could be the difference between getting very dangerously high alcohol, blood alcohol concentration levels to the point of alcohol poisoning and potentially even the difference of lethal dose for young people of very low body weight. So we were curious. We did these surveys where we asked about consumption, but were people actually consuming one or more of these products? So we turned to where young people post videos of themselves doing stupid stuff, YouTube. So we did a study where we examined rapid consumption of supersized alcopops on YouTube. We quickly found, we sped this video up just to show you, one of the videos. But in this video, this individual shotguns 3 cans of Four Loko within, I believe, 2.5 minutes. And so, again, resulting in dangerously high blood alcohol concentration levels. But we readily found, well over 100 videos of people rapidly consuming 1, 2, or 3 cans of this product, all within a couple of minutes. So, given that, we were curious whether we would observe in calls to U.S. poison control centers, a noticeable amount of calls for supersized alcopops, and whether these were for underage drinkers. And so what we did is we mined the data. We conducted a secondary analysis of calls to U.S. Poison Control Center data, and we looked across time, so from 2010 to 2019, so more recent years here since the caffeine's been removed from the products. The proportion of calls, the number of calls, or the proportion of calls for alcohol products generally, which is pretty stable around 20 or so percent, the proportion for underage drinkers, versus the percentage of calls for underage drinkers among those who'd consumed supersized alcopops. So as you can see, there's a noticeably higher proportion of calls for underage drinkers among those who consume supersized alcopops in U.S. poison control centers. And this isn't surprising, again, given the preference for these products among young people, the high blood alcohol concentrations that they would get as a result, and that these products really appeal and are marketed to a young demographic. So I thank you for allowing me to share a lot of my different research studies that I've conducted on these products. Here's a list of the full citations of these studies on supersized alcopops. I'll turn it over in a second for questions and answers. But before I do that, I want to just kind of summarize these findings and talk about how you all might be able to begin to assess the issue of supersized alcopops or other problematic, potentially problematic, risky products that may be emerging in your areas. So just to kind of summarize.
Hey, Matt?
Yes.
Sorry, it's Kristen. It looks like there might be something open on your desktop. There's a little gray box covering part of your slide.
Was that it?
Yeah, that thing. Yes.
Okay, great. Thank you for letting me know.
You bet. Oh, and people have been asking if the slides are going to be available. I just want to remind everybody that we will be able to send out a PDF of the slides after the presentation is over. Sorry,
Perfect.
carry on.
Great, thank you. So yeah, just to kind of summarize our findings in terms of what is problematic about these products, it's basically everything left about them. They are incredibly inexpensive, both in their retail price and how they're taxed. They're taxed as malt alcohol, and I'll talk a little bit about that. So they're among the least expensive ready-to-drink alcohol product available on the market, and we know price is important. They have high alcohol by volume, facilitating heavy consumption. They have heavily flavored, sugar sweetened fruit flavoring that masks the taste of alcohol, the high amount of alcohol in them. The alcohol content is so confusing. It's almost impossible for anyone, let alone young people, to understand how much alcohol they're consuming. They're sold in these large containers with appealing marketing, not only on the cans, but in the social media presence and other marketing. They're taxed at low rates because they're regulated like malt alcohol. And again, in large part because they're regulated like malt alcohol, they're available in the types of stores, gas stations, convenience, neighborhood stores. They have greater retail availability in general, but they're also available in the types of stores that underage young people have access to, that they're able to patronize for their products. So I mentioned, so just to kind of reiterate, I can't imagine what else the alcohol industry could do aside from just like handing these out to be able to better get high quantities of sugar sweetened alcohol into the hands of young people. It's really like the perfect storm in terms of just really dangerous alcohol. And we've observed that in Canada, the regulations took place after the death of a young adolescent. They regulated alcohol to these products specifically to cap the alcohol content at 1.5 standard alcoholic drinks. And in the U.S., we've had death after death after death from consumption of these products. Not only underage young people, but drunk driving traffic crashes where there's one can of Four Loko found in the car that has resulted in fatalities, and no real meaningful federal regulation of these products. So one of the main issues in terms of federal regulation is that they're regulated as malt alcohol. I have a paper down here that I cited that states that they are likely in violation of federal laws defining malt alcohol, that they are probably non-compliant with the current definitions, and that appropriate that this is important for public health reasons. It's a major issue for the protection of public health and safety because reclassifying them as distilled spirits would remove them from these types of stores in a number of states. The gas station, convenience stores in a lot of states, they would only be able to be sold as in state-controlled liquor stores. That could also mean that these states could choose to delist these products if they were regulated as distilled spirits, those with control of liquor. Also, it would result in increased price because distilled spirits are taxed at a higher rate. So to put this in comparison, these three cans of Four Loko can have the same alcohol content. They do have the same alcohol content as a fifth of vodka, but they may be available for about 1/2 of the retail price. So again, they're more comparable to the price of just really cheap vodka than they are to any other ready-to-drink alcohol product on the market. So there's been some state efforts to try to change the pricing on these products. These efforts have been quickly overturned as a result of industry lobbying and litigation. So really, where movement is needed on this right now is at the local level. And what's promising is that I've worked with Ryan Treffers, who's done a lot of work studying this area and these products specifically, and state preemption. He's a legal expert, and he stated that despite kind of the strong, even in the face of strong state preemption, there's something that nearly every community can do to better regulate these products specifically and alcohol generally. It requires understanding, though, that what the state preempts, but some potential options that may be available to your community, again, depending on what's preempted at the state level, could be things like voluntary alcopop free zones or alcopop free zones through local ordinances, bans on single serving malt alcohol or supersized malt liquor or supersized alcopops. So there's been one study that I cite down here, the McKee et al. Study from 2017, that has shown that this has occurred in a natural experiment in 2 areas in, I believe, Minneapolis, Minnesota, and in Washington, D.C., but through either local ordinances, which affect entire areas, in their case, wards, or through the enforcement of alcohol-related nuisance laws, which would pertain just to specific stores that were in violation, that policies targeting malt liquor sales were associated with reduction in assaults, vandalisms, and other crimes. So that's really promising in terms of the findings that something can be done about these products, and that these products are really implicated in these harms. So, and these products being because those laws were more pertaining to malt liquor, so high alcohol content products that are sold single serving, large volume, high ABV. And one of the other things that can be done is just general enhanced enforcement of laws related to either selling or the provision of alcohol to those under 21 years of age. So now that we've kind of learned more about the kind of issue of supersized alcopops, what are some of the things that may be able to possibly be done? What should be done? So we know that these products are problematic nationally, but why should your community care? So this takes an understanding of what are the local alcohol-related issues in your community, and how are those local alcohol-related issues linked to other aspects of either social justice, quality of life, or other values of your community, what people in your community care about. And so local data collection can help with this. It can help understand these issues. It can help build a strong case for this change. So in thinking about this, I'll take you through a few different examples of different types of data collection specific to these products and alcohol marketing in general that can help tell this story, that can help support local change. But just kind of as a caveat, wanting to keep in mind who that target audience is, who the decision makers are, and what is the important message for that audience. It could be more of a youth prevention perspective. It could be from, if there's issues with crime or noise ordinances, it might be from a social justice perspective. If there's historically disenfranchised neighborhoods in your community. So just keeping that in mind as well. So the three main broad types of data collection that I want to talk about that may be of use to you and your community would be retail environmental scans, mapping, and surveys, interviews, and focus groups. So first, with retail environmental scans, one way to think about alcohol marketing is through this 4 P's of marketing: products, price, promotion, and placement. So I'll provide you an email address where you can get more information about like an official environmental scan document that you all can have free access to that could be very useful. That's through the U.S. Alcohol Policy Alliance, but I'll provide more information about that at the end. But these scans can include images, which can be very powerful, of problematic products. So looking and seeing what products may pose a threat regarding all the things that we've just discussed: youth-oriented appeal, high alcohol content, the products themselves that may be especially dangerous, prices. So two for $6, 2 for $5. I just found cans of Steel Reserve for 2 for $4 in my community. So how low these prices are and how that can make high quantities of alcohol easily accessible. And again, youth have very much less or more limited disposable income, so it can provide them the ability to get dangerous quantities of alcohol. The promotions on the exterior, so there are oftentimes localities will have existing laws that may be violated with regard to the amount of exterior advertising related to alcohol products. So there may be disparities with regard to this in terms of where these stores are located. It might be of interest to note what the products are that are being advertised. There can be interior advertising as well, as you can see here, the products. And the placement of products, as we'd mentioned, product placement, not just that they have dangerous products, but that they're storing them literally right next to, products intended for, consumers of all ages, including young people, milk, juice, chocolate milk. The placement could be not only in coolers, but putting, alcopops next to chips in the chips aisle or on end caps, or having different, built displays with beer cases. So retail scans can be a very useful tool for understanding the local retail environment. These can also be used in conjunction with mapping. And what mapping can do is help identify whether some of these hazardous conditions or risky retailers that carry risky products or have excessive marketing that might be, viewed as tailored towards young people or more disadvantaged members of society. It can map those to identify issues of social justice, mapping next to schools to look at things like youth access. If you're able to work with and collaborate with your local police department and get information on calls for service, you can map things like crime or nuisances. And this can be some great baseline data. So there's additional guidance for this through the CDC. They have a guide for measuring alcohol density. I just wanted to give an example too of what this can look like. So these are calls for service. This is Miami Gardens, one of the communities that I've helped work with. What this represents is the alcohol retailers, and there was different buffers of different distances. I think this one's a 500-foot buffer around alcohol retailers, but it's essentially used to show you can quantify and say things like, although 500 feet around retailers only represents about 10% of the total land space of Miami Gardens, it encapsulates 50% of the crime. And you might be able to break that out further by the types of crimes and show that certain types of crimes are very much disproportionately located around retailer. These different colored dots actually represent different types of crimes. You might be able to find certain retailers that might have like these red dots here might be a particularly problematic crime. And so you can identify, potentially where resources needed to be devoted to understand, what is it about these locations? Is it that that the parking lots are serving as a place to distribute illegal drugs, or are people being served where they're overly intoxicated, and is this a hub for people who are heavily intoxicated to be interacting? So this mapping can be very useful to help tell your community story. Another type of data that might be very useful, especially for these products, but also for alcohol generally, can be local primary data collection with target populations of interest. So this could include surveys, interviews, focus groups. So it might be you would want to provide some clear definition of what you're talking about when you're referring to supersized alcopops, but figuring out who in your community is drinking supersized alcopops. Is consumption prevalent among underage young people? If so, how are they obtaining them? What do they find appealing about them? How much are they consuming? What are the consequences that they're experiencing? And are these products being disproportionately consumed by other, especially at-risk or vulnerable subgroups in your communities? So one example of such a survey study that we did was among a among a population of people who were on probation for various things, but they had used substances within the last 30 days. So what we found is that those individuals who had experienced homelessness within the last 30 days, or who were current gang members, were far more likely to be current consumers of supersized alcopops, to have consumed a supersized alcopop within the last 30 days. So again, this data may be able to help tell an important story in your community. So I'd mentioned the retail environmental scan forms. So for the U.S. Alcohol Policy Alliance, if you email this email address, info@alcoholpolicy.org, and inquire about these retail environmental scans, there's a standardized form that they're using for communities all across the United States to be documenting the types of products that they're observing, to take pictures of them to see, what the marketing looks like, and to document other important features of the marketing mix for these products: price, availability, the signage, advertising. And it's a really great resource that's freely available. They want you to email them so that they can provide a little bit of explanation and training to make sure that this is done well, that it's in a standardized way, so that the data that is collected through this, you'll be able to use the web link to have multiple people in your community conduct these scans. You'll have access to the data. It will be provided to you on the back end, all of the data from your community, but it's also useful to have this standardized so that they will be able to look at and identify national trends that haven't been identified systematically like this before. So I strongly encourage you to reach out about this retail environmental scan form that you can use. It's electronic, very user friendly. I've seen the form as well, and I think it's a great tool that's really available to you. There's also there'll be information about a third part of their series that is going to be related to essentially what local policy options are available for not only supersized alcopops, but other potentially high-risk products that are emerging on the market: the hard sodas, hard seltzers, and even food-type products like ice cream or whipped cream that are infused with alcohol. What can be done about these products on a local level? So just wanted to put in a pitch for that those available resources for those who are interested in, continuing to examine this issue in your community. So with that in mind, I want to know how I can be helpful to you all. I have a few discussion questions if we have time to kind of pose to you all to kind of get some discussion rolling about how you might be able to, or what you might want to do to further assess these issues in your community. But before we move on to that, I would be happy to answer any questions that you all might have for me.
Thank you so much, Matt. Wonderful presentation, really terrific. We've had a bunch of questions already, so let me cue some of those up, and Kristen can help collect any that I miss. But there was a great question you might recall that was asked early on about what's changed in terms of either these products or, well, especially about these products, the nature of these products over the past 10 years. Someone noticed that some of the studies were about 10 years old or older, and we're curious about what's changed in terms of serving size, alcohol content. You talked about serving size a little bit, but can you answer that question?
Yes. Yeah. So the major change, and I would say that the major change that's happened was in 2015 when they increased the alcohol content of these products from the most that they'd had before was 12% or 4.7 standard alcoholic drinks to 5.5 standard alcoholic drinks. That would be the main one. They've also increased, it seems like they've increased market penetration, that it's more readily available, that there are more flavor options, more targeted marketing. I don't know if you've seen these. We have these in Texas now, the Four Locos that look like this. So I would say that there's heavier social media presence since 2010. That there's more online marketing of these products, and even what's challenging now is the user-generated content of underage young people's during the pandemic, dressing up like older individuals and going into stores to with their masks on to buy products like these and things like that. So in terms of meaningful regulations, in 2018, the Canadian government cited some of our research in their nationwide reclassification of these products, where they limited the products to 1.5 standard alcoholic drinks throughout Canada, and that was after one fatality of a I believe 13-year-old female who got her hands on a couple of these during her lunch break. And in the U.S., we've had death after death after death, and no meaningful regulations of these products from a public health perspective.
Right, right. Thank you. Another question, really interesting one, is are these products more popular in states that have distilled spirits, sell distilled spirits in state stores? In other words, control states. And so, any thoughts on that question?
That's a great question. I don't think that we have that data right now, but that is a great question. So if their sales are limited to state liquor stores, well, I would say that right now they're limited as malt alcohol. So I don't think many states would limit their sales to liquor stores. But there are different state policy environments that may affect their popularity or not. But we don't have great brand level alcohol consumption data, which is really what's needed to answer that question.
Right. Thank you. Another question that just came in from Jordan Warnick, interesting question, says you haven't really said too much about age identification. And of course, of age folks in social, in terms of social availability, can provide these products to underage people. But is there more that needs to be done in terms of age identification, age validation?
Absolutely. Yeah. In our surveys of first time Four Loko consumption, most of them got it through social sources. So, an older friend or relative who provided the product to them. So absolutely more is needed not only for, those fewer who were able to purchase or steal the products themselves, but also for the, most of them, how they're getting it is through social sources. So being able to better detect and enforce those laws pertaining to that maybe might fall within social host if there's having parties or things like that at a residence, but absolutely more work is definitely needed in that area as well.
Thanks. So another question, and I think we've gotten this from a couple of folks, is why can the federal government just increase the tax on high alcohol content, suppose ostensibly malt beverages, these sorts of beverages? Can the tax rate be increased at the federal level? And let's ask about the state level as well, because I think there's an argument for there being perhaps more opportunity or more traction, at least in some states.
Yes. So yes, that is a possibility at the federal and at the state level. I would say at the federal level, I would say a major issue with regard to this is their classification as malt alcohol versus distilled spirit, that we've encouraged the TTB to investigate this issue with no luck so far. We've even had two Congress members write a letter to who was the former administrator at the time of the TTB, and they basically wrote back saying that this is what they do. So I think that could be a major way to increase the prices just by getting them appropriately regulated. I have a research paper related to why it's probably misclassified, but in a nutshell, can any of you name a beer that's 25% alcohol by volume that you can buy two of for $2? It's not, the technology just doesn't exist to make malt alcohol that inexpensive. And in order to have that high, like a 14% alcohol by volume base, you would need to brew a malt alcohol or beer that has that high of ABV. So the argument is that technology doesn't exist. And if it does exist, it's just to circumvent these laws that are designed to protect public health and safety. At the state level, yes, absolutely. And there's been some discussion as well about price floors. And I think price floors at the state level would especially impact these products because they tend to be the least expensive, ready to drink available alcohol product on the market.
Yeah, so that's really interesting. Is that pretty much the same thing as it's sometimes called minimum unit pricing? And which essentially creates a barrier to low-priced alcohol, and it's been used extensively in some of the English-speaking countries around the world, like Scotland, I believe, and Australia. And one of the really interesting things about it is that it's been shown to decrease disparities in alcohol consumption, especially by income and social class. So is it a similar concept to what has been tried?
Exactly the same thing. Yeah.
Okay, excellent. Well, let's open it up. Kristen, what else are we seeing in the chat?
I haven't seen any other questions yet. I think we've covered what's in the chat. So you guys, please feel free, or if you want to raise your hand, it should bring your picture to the front and I can unmute you if you'd rather just ask a question. But Dee Anderson did say that she thought that this is really valuable information. It'd be great to share it with parent groups and youth serving agencies, which I agree. Awareness is key.
Absolutely. And as you collect local data on these issues, getting, parents and local organizations interested in this product and having their support can absolutely help the kind of grassroots support for this to put pressure on local officials to make changes at the local level.
Absolutely. Yeah, I'm glad you shared about the scans that the U.S. Alcohol Policy Alliance, USAPA, is offering. So do email them. I believe it's an environmental scan that you can do right on your cell phone. So when and they provide information on how to do it, tips and tricks, what to avoid, and it looks like you're really just texting on your phone when you're conducting them. But like you said, Matt, it is a great way to inform your community by engaging them in the assessment of the problem.
Matt, I have one more question, if nothing else comes up, and that is, what are the next directions for your own research? It's been so productive and impactful. Maybe not as much as you would wish in terms of policy change, but it's certainly getting media attention and seems to be translating into policy, or at least policy discussions in some venues and in Canada. But where do you see yourself going with your research in the next year or two or three?
That's a great question. So I think what's going to be really important is that we need more brand level alcohol consumption data, especially among young people, underage young people. We don't have good data on what alcohol. We talk about alcohol oftentimes like it's this homogenous good, right? But we know that there's a lot of heterogeneity in terms of the products that are appealing to young people, what they're drinking, the risks that are posed by consuming those products. And so understanding what people are drinking, why they're drinking it, how they're getting access to it, the negative consequences associated with it, especially in light of large soft drink industries entering the market with the hards. There's been, to my knowledge, no national brand level data of alcohol consumption since these hard sodas, hard seltzers are hitting the market, and these alcohol infused other products, in terms of what people are drinking. And so I think this is a really important first step in guiding our policy initiatives, our behavioral interventions. So that's mostly, I'd say, for my next couple of grants, with the direction that I want to be heading in, as well as this issue of labeling, how labeling of alcohol products may be able to better inform consumers to make more safer decision making, but also how providing information may have unintended consequences. So if we are calorie labeling, are people switching to higher alcohol by volume products because they want to minimize the amount of calories that they're consuming? or other potential unintended effects? Are they limiting the calories that they're eating now before drinking? Or so I think the issue of labeling is really interesting as well. One other thing that I will mention is I am planning on doing more retail assessments of the alcohol retail environment, especially in Fort Worth, Texas here, doing environmental scans to see the availability of different products, not only whether or not a store carries certain products, but the amount of designated shelf space, where it's located in the store. And I'm hoping that our IRB will have a meeting with them tomorrow about this, but hoping they'll allow us to do purchase attempts as well to see if these features of the retail environment are associated with the likelihood of selling to a certain different types of products to a of age person, but who appears underage without an ID. So one research question that I'm really hoping to be able to answer is, for example, are these products that appear more like energy drink or hard sodas or hard seltzers, are they more likely to be sold to a young looking person without an ID than, a beer of comparable size? I think that's a really important research question as well, is that are these types of products potentially increasing access to alcohol among young people?
Great questions. Well, we'll stay tuned. We'll look forward to future research. And I don't see any other questions, but let me hand it off to Kristen and see if she's seen any. And if not, ask folks to do the formal evaluation. There are glowing tributes in the chat, by the way, Matt, and people really seem to have enjoyed and gotten a lot out of your presentation. So thank you so much. Kristen.
Thank you. I really appreciate it.
Matt, did you want to share any of those discussion points you had? You mentioned them at the end because we've got time.
Sure, that would be
So
great.
maybe-
So here's just three questions that I was hoping to pose to you all. If some of you want to answer these questions, that's great, but more as just kind of a reflection for thinking about where to begin in your communities. I'm curious what the local alcohol related problems are that you see in your communities. These could be related to social justice, safety, quality of life. Essentially, what issues do your communities value and care about? Is it underage drinking, crime? Is social justice a priority? So that's kind of the opening question to think about how, the important quality of life and how to frame this issue. And then how might alcohol generally or supersized alcopops specifically be contributing to these problems? And then given kind of your working hypotheses on how they may be connected, what local data collection could be really powerful to better understand these issues in your community, but also be able to help you craft the story to tell the decision makers, what should be done and essentially why. So if anyone wants to share their kind of initial thoughts on where they think that, if they think that there might be next steps for their community or where they're at with their community, I'd love to hear from some of the participants.
So here's one. Are you able to unmute people, Kristen, or I can read it?
I can. They have to see how I'm raising my hand. They'd have to raise their hand and then I could go down and unmute them.
Okay. Well, while you're working on that, I can paraphrase it. Somebody says, I can definitely see environmental scans and mapping being useful in the counties where I work. I'd like to especially look at alcohol access near colleges and universities.
Absolutely, yeah. Those tend to be the loci of much heavy consumption, for sure.
And do the manufacturers or the distributors pay for shelf space? Are there slotting fees like we know about from tobacco and some other alcohol products?
That's a great question. I'm not an expert on this issue. I believe that the three, I could be completely wrong about this, but I believe that that's what the three-tier system is like designed to try to prevent. But now that there are soft drink companies entering, I believe that they're trying to use their slotting that they have for soft drinks or something like that. But if someone knows better about that, please correct me.
Sure. Uh, Kristen, do you want to paraphrase Kimberly's question?
Well, Kimberly's just really stating that, you were asking about methods. She said that survey interviews and focus groups would be really helpful. And she talks about the importance of crafting the message around the local findings, really highlighting those local conditions. And I love that you talked about understanding what motivates the community. Is it the largest concern around drinking crime, or is it social justice?
It seems like there's a real strategic decision that has to be made between, who's the target of these communications. So one can imagine young people being the target, but these products were basically designed to appeal to them. And they're attractive. They're the perfect storm, as you so aptly explained. There could be messaging for parents so that they have some awareness of it. But it seems like to me, like maybe some of the most useful um, consciousness raising would be to around policy advocacy, to try to change policies in local communities and at the state level around taxes and some of the other strategies that you mentioned. Any thoughts on that?
Absolutely. I think local policy is really the way to go for this right now. It seems like there's a lot of backsliding at the state level with attempts to regulate these products. In general, that's where it's harder for the industry to fight back is at the local level, right? They can have a lot of um, they do have a lot of presence on, and effort that they push on Congress members and things like that. So at the local level, I think is really where change is needed. One thing I will say though is it's important to have a local assessment done if for these products specifically for your community for your state specifically pertaining to what can be done about these products. But I've worked a lot with Ryan Treffers, most recently in Miami Gardens, and he is very good at being able to identify what I guess not only what is definitely possible and definitely not possible, but also kind of where the gray areas are and where if your community might have some courage in one area, it could potentially open the door, set a precedent for other communities in your state. So
Great, thank you. Well, I don't see anything else happening in the chat except more accolades and a request for your contact info, which we'll share. So let me hand it off to Kristen for our closing ceremonies.
Absolutely. Thank you. Thank you so much, Dr. Rosheim. If you wanted to pop your email into the chat, I know people are sort of chomping at the bit to get that, and people are asking about how they get you to come and do a presentation for them. So I know they would appreciate that. So thank you everybody for attending. Earlier in the day, let me see if I've been cutting and pasting a couple things. All right, well, I just put the evaluation in the chat. When you close out, you're going to be sent immediately to complete the evaluation, and the certificate of attendance asterisk should be attached to that. If it doesn't work for you, because sometimes it's hard for people to find the certificate, it often downloads as a little PDF. I will be sending it out in a follow-up email. I'm gonna send a copy of the slides, and I'm gonna send the certificate of attendance and a reminder to complete the evaluation. And some of the other resources that Dr. Rosheim has mentioned today, I'll try to put links to those in the email as well. Make sure you're signed up for our listserv. We have a lot of stuff coming up. We have a very busy January and February, and we're already starting to plan and schedule out for March. So lots of webinars, lots of great information. And with that, I just everybody stay safe and healthy during the holiday season. And if we don't, there it is. Leonard, oh, Leonard gave it to me. Let me cut and paste